Have you ever heard of diabetes, or you know someone living with diabetes, or you are living with it, or you've never even heard of it at all? This video is for you, so stick around and let's talk diabetes. Hi guys, welcome back to my channel. I am Dr. Ogusa if you are seeing my face for the first time. If you want to see more content like this, why not subscribe and hit the notification bell so that you'll be the first to get notified whenever I post informative content like this. So let's go right into the topic. Diabetes, also known as diabetes mellitus, is a chronic medical condition that affects the way our body utilizes glucose, and glucose is the main source of energy in our bodies. What happens in diabetes mellitus is that there is a defect or a relative defect in the utilization of insulin, which is a hormone produced by the pancreas, which helps us push or drive glucose into the cells for our bodies to utilize. So in diabetes, there can be insufficient or no production of insulin at all, or insulin can be produced but the body will not be able to use this insulin. So that brings us to the types of diabetes. We have the type 1, the type 2, and the gestational diabetes mellitus. Type 1 diabetes mellitus, which commonly affects children and younger people, although it can also affect older people, is an autoimmune condition in which the body mistakenly attacks the beta cells of the pancreas, which is responsible for the production of insulin. So by the time those cells are destroyed, insulin will not be produced, and then the glucose in the body will not be able to go into the cells for utilization. So that is what happens in type 1. For type 2 diabetes mellitus, it is a condition that majorly affects older people, but it has started affecting younger people now. So everybody is supposed to be on alert to check for the signs of this disease. So it is majorly related with lifestyle habits, diet, and being overweight. It is a condition where the body produces insulin, but it is not effectively able to use it, or sometimes it may not even produce enough insulin. There is a situation known as insulin insensitivity. So that's what happens, that there is insulin but your body is not able to use it. So for gestational diabetes mellitus, it is diabetes occurring for the first time in pregnancy, which may or may not resolve after the birth of the child. So this diabetes occurs in pregnant women. It is noticed for the first time during the antenatal care of the woman, and this puts the woman at risk of the type 2 diabetes. Then we'll just talk about pre-diabetes, which is a condition whereby the glucose levels are elevated but not high enough to be called diabetes, but they are higher than normal. So now that we've understood the types of diabetes, we are now going to go into the symptoms of diabetes. So how do you know? What are the things that you will notice that will make you feel like, oh, let me check, I may have diabetes, or let me quickly go and see my doctor to check if this is diabetes? I'll tell you the symptoms that you can notice. First is frequent urination. So because of the elevated glucose levels in your body, your kidney overworks and tries to filter and reabsorb this glucose, and that leads to increased urination. So you notice that you are visiting the restroom more frequently to urinate, and because of this urination, because you are passing out this urine frequently and you are losing water, you have increased thirst. So you feel the need to drink water more often because you are losing fluid. That figures right, because you are urinating and you are losing water, you need to replace the water. Next one is increased appetite or increased hunger. So because your body is not able to utilize glucose, because the glucose are not being driven into the cells for you to utilize, you feel the need to eat more because your cells are starved of glucose. So it's not as if the glucose is not in the body at all. It is there, but it is not being driven into the cells. So it is now going to create this scenario that there is no glucose. So your body wants to try to eat to get the energy. Do you understand? So you are going to feel increased appetite or increased hunger. And then another symptom is fatigue. So because they are not getting the energy that you should be getting, you always feel tired and weak because there is no energy for you to utilize. So that definitely will cause fatigue. Next is unexplained weight loss. Weight loss because the body starts breaking down your muscles and your fat cells to produce energy for you, because glucose is not able to carry you. So if you start breaking down your muscle cells, your fat cells, to produce this energy for you to use, because we already understand how this happens, the deficiency or the relative deficiency of this hormone insulin, which is responsible for driving glucose into your cells. So when this glucose is not available, the body tries to create energy for itself, so it starts breaking down your muscle cells and your fat cells. And then we also have slow healing of wound because of the elevated levels of glucose in your body. The blood flow is affected, so there will be no sufficient blood flow to areas of wounds or injury for it to bring about healing. Because what brings about healing, it is the flow, the perfusion around the area that brings about the healing. So the excess glucose in the body affects this circulation and perfusion of the area and makes the wound to heal slowly. You can also feel numbness or tingling of the hands or feet because of the damage of the nerves. The excess glucose level affects the nerves, and that will result in numbness and tingling. And you can also notice blurry vision because of the excess glucose levels. But it is important to note that not everyone will experience these symptoms. That's why it is important for you to do your regular check, so that you can notice any elevation in your glucose levels as soon as possible, and you can report to your doctor. And do not just conclude or self-medicate whenever you see any of these symptoms. What you have to do, the reason for this video is for awareness. So what you have to do if you notice any of this is to talk to your doctor, and to not just assume that, oh, I had diabetes. Just do your regular checks, pay attention to your body, and report to your doctor if there's anything abnormal that you have noticed. I hope we are following. Now we're going to talk risk factors. We already discussed that the type 1 diabetes is an autoimmune condition in which the body mistakenly attacks the insulin producing cells. So there are really no risk factors for that. It is just genetic, so there's really nothing that you can do about that. So the risk factors are majorly for the type 2 diabetes, and we are going to divide it into modifiable and non-modifiable risk factors. Modifiable risk factors being that these are things that you can do something about, changes that you can make that can help you reduce your risk for diabetes. While non-modifiable risk factors are factors that are inherently there that you cannot really do something about. So let's just talk about it. The non-modifiable risk factors include age greater than 45 years. Although we started noticing diabetes in younger age, but increasing age increases the risk for diabetes. And then we have family history. If you have a close relative that has diabetes, you have a higher risk of developing diabetes. So we have ethnicity or race. Those of African or Asian or Hispanic descent have a higher risk of developing diabetes. And then we have previous history of gestational diabetes mellitus. So I mentioned before that if a woman has had gestational diabetes before in pregnancy, she has a higher risk of developing type 2 diabetes. So what are the modifiable risk factors? These include obesity. In the case of obesity, the body starts to become resistant to insulin. And then you have physical inactivity. In physical inactivity, you don't get to expend energy, so your body does not get to utilize glucose, and that leads to elevated glucose levels in your body. We also have poor dietary habits as a risk factor. And then we have high blood pressure, high cholesterol level, smoking as modifiable risk factors, because these are things that you can do something about. So we're going to talk complications of diabetes. Elevated glucose levels in your body can affect virtually all the systems in your body. So there is an array of complications that can arise. It can arise from any system, from anywhere, from your head to your toe. It affects everything, because these high levels of glucose, especially uncontrolled diabetes, puts your body in an immunocompromised state. So you can imagine how much damage this is going to cause. So let's just list some complications that can arise from uncontrolled diabetes. We have heart disease and stroke, kidney damage, which is also diabetic nephropathy, eye damage, which is diabetic retinopathy, nerve damage, which is diabetic neuropathy, foot damage, which can even lead to amputation. People with diabetes can also suffer from skin conditions. And then diabetes can also affect the mental health, because it is very stressful to manage and it takes a toll on the mental health of the individual and can lead to depression or anxiety. So you can see how much damage that this condition can cause. It's not something that you should play with. If you notice any of these symptoms, or you notice that your glucose level is elevated, you are supposed to see your doctor as soon as possible. Don't even wait till tomorrow. Go now as soon as you are noticing it. So how is diagnosis made for diabetes? How do we say that somebody has diabetes? I'll tell you. There are tests that can be done if you want to test for elevated glucose levels. We have the fasting blood glucose test, which is done in the morning before you've had your first meal for the day, and we have the random blood glucose test, which can be done at any time of the day after you must have eaten. And then we have the oral glucose tolerance test. We have the urine test. So make a diagnosis of diabetes. A fasting blood glucose level of 120 mg per dl or higher, or 7 millimole per liter or higher, taken on 2 separate occasions, can be diagnostic of diabetes mellitus. If the glucose level is higher than 100 mg per dl or 5.6 millimole per liter, that is said to be a pre-diabetic state. So the blood glucose is elevated, but it's not elevated enough to classify it as diabetes. That range is classified as the pre-diabetic state. So 100 to 120 mg per dl or 5.6 to 7 millimole per liter. If you regularly check your blood glucose level and you notice any elevation or you notice any symptom, you are not to self-medicate. You are not to go to the pharmacy to go and get any medication for yourself. You are to consult a doctor. This video is for awareness sake. It's for you to know what this condition is and how you can prevent it. So if you notice any of these things, or you have any concern or any worry, you are to consult a doctor and not to self-medicate. Are you following me? We've come to the prevention and management of diabetes mellitus. For type 1 diabetes mellitus, there is little or nothing that can be done because it's an autoimmune condition. It is genetic. But for the type 2 diabetes, there are things that can be done to reduce our risk for diabetes mellitus. And what are these things? We can improve our eating habits and start eating healthy. Introduce whole foods, fruits and vegetables into your diet. Reduce your intake of processed foods. And then portion control is important. So it is better for you to eat balanced diet in small portions throughout the day than for you to eat huge plates of food once or twice a day, because it can lead to a spike in your glucose level. And then you can also exercise regularly. Exercise cannot be overemphasized. I have talked about it in every health video I have made. If you have not caught up on other of my videos, the playlist is linked in the description, so you can check other health topics that we have previously discussed. So for the exercise, you can walk, you can run, you can swim, you can dance, anything that you love doing. Just do it. Try to move. You are not a tree, so get up, get moving, and you have to aim for a minimum of 150 minutes of moderate intensity exercises in a week, which should be spread apart in the week and not put into one day. So the 150 minutes should not be in one day but spread apart throughout the week. I hope you are following me. If at any time you have any questions, do not hesitate to leave them in the comment section, as I will be there to answer you. Regular checkups. Doing regular checkups can help you notice or catch any early stage of this disease and help you to manage it better. So you can immediately notice if there is an elevation in the glucose level or if you have any of these symptoms, and the doctor starts to manage you as soon as this is noticed, and this improves your outcome for the disease and reduces the complications that can arise from this disease. Stress management. So high stress levels can affect blood glucose levels. So the effective management of stress is an important factor in the prevention and management of diabetes mellitus. And then drug compliance. You have to be compliant with your medication. If you are already on medications, you have to follow your doctor's instructions. Take your drugs at when due. But people with type 1 diabetes, they have to take insulin on a daily basis, so make sure you take your insulin regularly. And for people with type 2 diabetes, most of them are oral medications, so you have to take these medications as prescribed by your doctor. Also, quit smoking and alcohol consumption. These are of no benefit to your body. Instead, they put your body in a state whereby you are predisposed to more diseases and more conditions. So quit smoking, quit alcohol consumption. I also mentioned useful tips that can help you quit smoking if you're already smoking. I mentioned it in the stroke video that I did, and it is linked in the description, so you can also check that out. So now that we've understood what diabetes is, we've talked about the types, the symptoms, the risk factors, the prevention and the management. We are going to bust some myths about diabetes, things that is common notion but is wrong about diabetes. We are going to be clarifying that, and I'm going to be replacing the myths with the truth. So the first one is eating too much sugar causes diabetes mellitus. That is not true, because while diet does play a role in diabetes mellitus, it is more about how the body processes glucose. So it is not really about the sugar, but how your body processes it. Like for the type 1, it is autoimmune, there is no insulin, so the body cannot process it. And for the type 2, it is that your body may become resistant to the insulin that is already produced, so your body will not be producing enough insulin. So it is more about what your body does to the sugar that you consume. And then the second myth is only overweight people can develop diabetes. That is wrong, because anyone of any size can develop diabetes. It is not something that is restricted to a certain body size. Any body size at all can develop diabetes. That's why we are encouraging people to do their regular checks, so that this thing can be caught on time. We have to spread the word. We have to share this video to anyone that you love or care about, so that they can be aware about diabetes mellitus, because so far we've talked about how debilitating it can be, so it's not something that you want to play with. And the third myth is that people with diabetes should avoid carbohydrates completely. That is not true, because with proper management, by taking their drugs, by doing their regular checkups, people with diabetes can still eat a balanced meal. And what is a balanced meal? A balanced meal is a meal that cuts across all classes of food. So you see that the carbohydrate cannot be cut off, because it is part of a balanced meal. I hope you've understood all we've discussed so far. If you have any questions, do not hesitate to leave them in the comment section. And if you have any contributions, also leave them in the comment section. Diabetes mellitus is a complex condition, but understanding it is the first step to managing it. And that is what we have done today. We have understood the concept of diabetes. We're going to be able to manage it better now that we know about it. By taking steps like eating healthy, exercising, doing regular checks, we are one step ahead of diabetes, so we can catch it on time if it's there, or prevent it if it is not there yet. Thank you so much for joining in this video today. I hope you found it educative. If you did, why not give it a thumbs up, leave a comment, and share to somebody that you love, to better create awareness about diabetes mellitus. And if you have not subscribed, why not subscribe, so that you can see more videos like this, and hit the notification bell so that you'll be the first to get notified whenever I post new videos. Thank you so much for watching. Take care, stay well, and see you in my next one. Bye for now.